Bismillahirrahmanirrahim. Assalamu alaikum. Myself Muhammad Jawwad and my case is Pyometra and cervical wedge resection in a mare. So Pyometra is uncommon in mare and it seldom causes systemic illness. Pyometra often result from cervical fibrosis, adhesions, retained endometrial cups or conditions such as persistent corpus luteum. The treatment of the Pyometra include both the medical treatment and surgical treatment. Medical treatment include the uterine lavage and surgical treatment include the cervical wedge resection and ovariohysterectomy. However, ovariohysterectomy is rarely practiced. Moving towards the case presentation, a 21-year-old Irish sport horse mare was presented with inappetence, lethargy, and weight loss despite the abdominal distension. Now, the point is that the mare has never carried a foal to the term, but it has been used to produce multiple offsprings via the embryo transfer. The last embryo transfer was done in 2013, and in 2014 the owner again tried to use the animal for embryo transfer, but they did not succeed, and there was a mucoid sterile fluid in the uterus. The cervix was difficult to navigate due to its length, tightness, and tortuous nature. This has been exacerbated by the multiple embryo transfers. Palpation revealed a grossly distended uterus, and the ultrasonography revealed ecogenic intrauterine fluid. So diagnosis was Pyometra secondary to the cervical fibrosis and adhesions. Now the initial treatment include in the initial treatment the animal was sedated and the cervix was manually dilated, and a small bore NGI tube was passed into the uterine lumen to facilitate the drainage of 115 liters of thick non-odorous purulent material. Then the uterus was lavaged with 0.9% NaCl. The animal was administered some NSAIDs and antibiotics, and it was maintained on a 10-day course of trimethoprim sulfa. Now, as a permanent solution to this problem, the cervical wedge resection was performed. The animal was sedated, and epidural anesthesia was given to the animal, and adherent within the cervical canal were broken down, and a full thickness wedge resection shaped defect was created with the apex of the wedge pointed cranially. And the post-op care include the topical steroid antibiotic ointment, and oxytocin was also administered to facilitate the uterine drainage. And now moving towards the post-operative management, the mare was evaluated once daily for 3 days after the surgery. The internal cervical os was gently dilated to facilitate the drainage of the fluid. The external cervical os was dilated with the help of two fingers, and internal with the help of one finger, and antibiotic ointment was applied routinely. And routinely there was ultrasonographic examinations, and if there were any fluid, ecogenic fluid in the intrauterine fluid, then the uterus was lavaged with 0.9% NaCl. So this daily cervical dilation and ointment application was continued for 4 weeks, then every other day after that. तो उसके बाद जब अल्ट्रासोनोग्राफी परफॉर्म की गई, वक्त गुजरने के साथ साथ जो यूट्राइन फ्लूइड है वो कम होता रहा. तो कॉम्प्लिकेशंस एंड रीवैल्यूएशंस को अगर देखा जाए तो 6 weeks लेटर माइल्ड थिकनिंग 5 centimeter इकोजेनिक फ्लूइड इन द यूट्रस. 9 weeks there was a some another finding that cervical dilation was observed, and 10 centimeter ecogenic fluid was observed in the uterus using the ultrasonography. To more closely see this dilation, the endoscopy was performed, and that revealed circumferential dilation and stenotic internal cervical os. Circumferential dilation cranial to the cervical canal. Uterine lavage was no more feasible. The owner was given two options to either select the systemic antibiotic course or standing ovariohysterectomy. The culture from the fluid of that dilation discovered Actinobacillus rosei, sensitive to multiple antimicrobials. The owner declined both the options. However, the mare continued to drain approximately 240 ml of uterine fluids from vulva each day. However, no systemic illness was observed. And the male reproductive tract is examined once monthly by both transrectal and transabdominal ultrasonography to ensure the uterus does not become markedly distended. Now the animal, the mare, is comfortable, so there is no marked distension of the uterus and no systemic illness. Continuous valvular discharge is happening, and the mare is enjoying his life, and the owner is riding the mare without any complications. Thank you very much.